At Aga Khan, we are privileged, I think, to have an excellent one-stop diabetes facility. So you have both the doctors and the diabetes educators. So what that means is that you have access to a consultant who is trained, especially in diabetes, and they will help you with the management of the medication aspect of your treatment. Many times when you talk about the appointment structure, we would usually see you a bit more frequently at diagnosis. But actually, for the well-controlled person with type 2 diabetes, we have individuals we see twice a year because actually they are doing most of the work. So our role is to equip you to take such good care of yourself that your encounters with the healthcare professionals actually are at minimum and you lead a normal life. So ours is to guide and to empower you. So we have the nurse educator who is trained in now I think the softer, more details of diet, of helping you with your glucose monitoring. So checking your sugars daily is a big part of, initially, of management of diabetes. Just understanding how are your glucose levels, how do I adjust my diet and my eating and my exercise to fit in with your lifestyle and your medication. So the role of diabetes educator is both educative, it's social for support even of your loved ones, and they are available to do that as part of care. And then finally we have what we call a hotline, 24-hour hotline service. And that just gives you a telephone number that you can actually call if you found your sugar was too low or too high and needed access to some guidance. If you look at years before, what has changed significantly is just the access to monitoring. And one of the more recent ones and services that we give here is called continuous glucose monitoring, where you actually can have a gadget placed on you that can check your sugars over 5 to 6 days, and you bring it back and we are able to interpret and look at your glucose readings both through the day and at night. And that helps the clinician really work together with the individual who has diabetes in terms of understanding patterns, in terms of understanding diets, and how we will manage your medications, especially for those who are on insulin or have erratic sugars.